Okay, we're on Chapter 5, Part 2, and we just have a few more slides to finish this section up. This slide was on your, on Chapter 2, Part 1. Again, it's a good summary slide of causes of prenatal, perinatal, and postnatal implications when someone has intellectual disabilities. So this is a good slide to use as a study slide. Now, we've spent quite a bit of time talking about intelligence tests, so I'm not going to go over this too deeply, but most practitioners prefer individual over group intelligence test. And one of the quick ways that you can determine someone's IQ is to take their mental age, divide mental age by their chronological age. So, for example, Bobby's 10 years old, on an IQ performs on an IQ test as an average 8-year-old. That's the mental age, and then 8 divided by 10, IQ of 80. That's a very, very rough estimate, but it's one way that that you can look at intelligence tests. And Dr. Knott, who will be here on one of our class days, will talk to you a little bit about intelligence tests. So some precautions in use of intelligence tests. Again, we've covered this before. Individuals' IQ can change as they become older. IQ tests are culturally biased to some extent. So people in different parts of the country or in different economic status structures may perform differently than others. So the younger the child also, the less valid the test. So when you're testing somebody for kindergarten or first grade for an IQ, it's very difficult to get a valid IQ test. And they're not an absolute determinant when it comes to assessing a person's ability to function, especially when you're dealing with those with intellectual disabilities. So again, IQ tests are still used. They're usually administered individually, but there are some precautions that we need to make when we're working, or when you're working with someone that's dealing with intelligence tests. Now, keep in mind, intelligence tests would be used during the comprehensive assessment phase, so moving somebody out of the tiers and possibly moving them into special ed would be when we would encounter an intelligence test. Okay, back up here. All right. So going back to adaptive behavior, again, when we're looking at students with intellectual disabilities, we're looking at a couple different areas. One is their ability to adapt, and there are instruments and assessments that can be used to assess that. Their ability to be able to perform adaptive skills, life type of skills. So some different deficit areas that we see with students with intellectual disabilities. These are very similar to students that have learning disabilities. So these are deficit areas. First of all, working memory, again, ability to keep information in mind while simultaneously doing another cognitive task. So if I'm reading or attempting to read, and I'm attempting also to take notes, and I'm attempting to pay attention to the author's purpose, it'd be very difficult for someone with intellectual disabilities to manage all of these tasks. They can pretty much need to focus on one aspect of a task. Self-regulation, in other words, they have difficulty, or they don't, or they may not have the mechanism to be able to recognize how their behavior impacts another. And I guess in some cases, if you look back at the story or at the movie Forrest Gump, there you can think of times when he didn't really recognize how his interactions with other people were taken. And metacognition, awareness of what strategies are needed to perform a certain task. So the idea of knowing that you know. Students with intellectual disabilities have much difficulty doing this. Students with intellectual disabilities are generally externally motivated as opposed to internally motivated. So to be able to tell someone with intellectual disabilities that they need to study because it'll help their grade or help them be a better student, chances are that won't register with someone with intellectual disabilities. They need to have some type of material or external award. And this idea of gullibility, the tendency to believe something in spite of scant evidence. If you remember the story I told you about the young man with intellectual disabilities that worked in a Publix grocery store, and there was someone that asked him to meet him in the restroom at a certain time each day. Again, gullibility, not really knowing what they're getting themselves into. So those are some deficit areas that we see with students with intellectual disabilities. So some educational considerations. How do we work with such students? First of all, most of the people that work with students with intellectual disabilities will have a degree in special ed. So if you decide to go in that field, you're going to have special training on working with Down syndrome students, with working with students that have special needs. And oftentimes students will come up to me and they'll say, Dr. Bruner, I really want to get a degree in special ed. And I'd say, yeah, that is a great idea. But I have found in my work as a principal that it's important to have an idea of how regular classrooms function as a foundation for that work in special ed. So I always encourage students, again, they can do what they want to do, but I encourage them to put 2 or 3 years into a regular classroom so that you understand what classroom teachers deal with. And then if you're really interested in going on to special education, go and get your certification or get your master's degree in that area. Make sure that's what you, and then learn how to deal with students. The other thing that's helpful with that approach is that I've known a lot of special ed teachers who go into that area and they work 5 or 6 years, and it's very, very challenging work. And then sometimes they get burnt out, and so they want to come back into a regular classroom setting and work in that setting for a while, and then possibly go back into special ed. So being able to have both of those certifications is very helpful. So functional academics will be something that you would learn if you were working with students with intellectual disabilities. That's the daily living skills, how to read a newspaper. I'm not sure telephone books are something you would need nowadays, but being able to look up addresses on a computer, completing job applications, reading labels at stores, possibly studying to obtain a driver's license. That the functional academics is really at the core of instruction with students with intellectual disabilities. Sure, there are going to be some academics involved, but for the most part, you're going to want these students to be able to function, to build their academic behavior base so that they can function in society. Right? And if you go onto YouTube, there are many clips, if you have time, to look at the use of functional academics with students with intellectual disabilities. Right. Here's a clip. It's 18 minutes long, but watch the first 5 minutes of the clip to see what connections you can make to what we've learned so far about intellectual disabilities. Feel free to watch the entire clip if you can. It's an inside and personal look at what it must be like to have a mild or intellectual disabilities. In what ways is this young lady like Renee, who we met at the beginning of the chapter? In what ways is she not like Renee? So I think what this clip helps you to do is also to understand the spectrum of disabilities in the intellectual disability area. So some strategies in working is you want to be able to prompt students. You want to be able to get them to notice that you're getting ready to teach. You want to catch their attention. You oftentimes need to model. If you're teaching life skills, you need to show them the skill first, or you need to model what's involved in the skill. Oftentimes, if there are steps, you need to break those down and model each step. We talked about the fact that students with intellectual disabilities are externally motivated, so the idea of giving them positive reinforcement, whether it's a token, whether it's play money where they get to buy something in a store, those types of reinforcements are important. And then there's something called constant and progressive time delays. So when we're teaching a student with intellectual disabilities a new concept, we might want to give constant reinforcement, and then as the student becomes more proficient in the skill, we would have what we would call progressive time delays. So we kind of move back on the amount of time that we reinforce students. But we start again with constant and then move back into more progressive time delays. Something that Dr. Knott will talk about tomorrow will be functional behavior assessments. And these are, if students have behavior issues along with their intellectual disabilities, it's a way to, or a method, an approach, a framework to try to discover what that misbehavior is. So identify the purpose the behavior serves the person. In other words, why are they, why is this behavior something that they want to elicit? Why is it occurring? What is it that's motivating them to show the misbehavior? Antecedents involve what triggers the behavior, what sets it off. Is it the time of the day? Is it being around certain students? Is it fact that they haven't eaten? Are there things going on at home? So trying to anticipate those antecedents or to try to discover what those are. And then positive behavior intervention and support is, once you do that assessment, it's really looking at the total school environment and setting up structures, ways to help reinforce all students. So whether it's walking down the hall in a manner where we're not touching other people, whether it's reinforcing positive behavior, whether it's following school rules, setting up an environment not only in the classroom but in the entire school to help reinforce positive behavior, positive outcomes for students. Some other ways that we would monitor assessment would be curriculum-based assessment, which we've talked about that, using materials within the classroom, fluency, not only fluency in reading, but fluency in being able to take care of regular tasks. So how fluent are they in being able to, let's say something very simple, and being able to tie their shoe, or being able to look something up on the internet, or being able to dress themselves, getting into some very basic areas, or ability to greet someone or say goodbye to someone. Again, how fluent are they in those adaptive behaviors? And then the MAZE procedure is a comprehensive assessment for students who are able to read. It's an assessment where you leave out certain words. For example, every seventh word you would leave out, and see if the student is able to determine what that word is based on the context. This would probably be for more advanced students with disabilities, also more in line with someone that would have just reading disabilities. So there are different outcome measures when we're looking at students with intellectual disabilities. We certainly are looking for measures of academic skills. Again, they might be very basic, but we want to assess those. We certainly also want to look at behavior skills, because we know students with developmental disabilities, may also have behavior-related issues, and we want to look at measures of quality of life skills, again, their ability to show adaptive behavior. Accommodations that we would have for students with intellectual disabilities, adjustment scheduling, our presentation format, how we're going to do that, our response format, and then having some alternative assessments, especially in the life skills and vocational skills area. Just like we talked about in learning disabilities, we want to make sure that students with intellectual disabilities have a degree of self-determination, that they be able to examine or think about the goals where they're headed to in their lives. In their life, oftentimes parents need to be involved in those meetings, but as students begin to be 16 or 17 or 18, you want to begin to have those conversations with them so they can begin to make decisions about their future. And we also want to look at transitioning again from high school programs to community programs or the world of work. And so transition programs include, what are survival skills out in the community? What do they need to know when they're interacting with people in grocery stores and out in the community? What type of employment opportunities are there? What type of training opportunities are there? When we talk about sheltered workshops, we're talking about workshops that are just for those with intellectual disabilities. And there's many communities that have such supports in place so that students with intellectual disabilities can obtain employment and begin to lead as much as possible, independent life. Okay? And don't forget to check out the self-assessment, and we are finished with Chapter 5, Part 2.